On the 15th of January, 41-year-old filmmaker Rupert Shean found out that he was COVID-19 positive. For the next 11 days, he self-quarantined at home in radio silence from the Ministry of Health. Since testing positive, Rupert made numerous calls to the Ministry of Health to try to figure out what his next course of action was, all of which went unanswered. With the coronavirus rapidly draining him of energy, he resorted to his own self-quarantine.
Well, in a sense, I was lucky because I didn't show that many symptoms. I personally felt extremely tired. Like, you just imagine you haven't slept for days, you've jet lagged, all of those feelings. You have no energy. I had enough energy to make myself food, but I had no energy to think. I couldn't think. I slept 10 hours or 12 hours at night, and then in the day I slept maybe 5 hours or 6 hours, just constantly exhausted, which was very tiring. You know, it's actually tiring to be tired, you know.
When Rupert was infected, the hospital gave him an odd instruction, one that not many Malaysians were aware of. He had to report that he tested positive through the MySejahtera contact tracing application on his smartphone.
Monday, I called Glen Marie, but they were impossible to reach. So I called them and I couldn't get through. So I emailed them and they did reply, but they just said, please, can someone answer this, etc. But no one actually responded. On the email, they just said, please self-quarantine and someone from the government will contact you. I also phoned a local hospital, so like a public hospital. I phoned just to get a second opinion, and they said the same thing. They also told me to fill out the MySejahtera app, where you can update your status through the help desk. I did that on Tuesday morning. And I actually got a text message from KKM to say you have been registered as COVID positive and on Tuesday, the 19th. Please be informed that you have been confirmed to be COVID-19 positive. Kindly go to your MySejahtera profile to refresh your status. So that was the only information I got.
12 days later, he finally received a call from his district health office with an apology and a shocking reason as to why it took them so long to realize that he was infected.
I was contacted by Dr. Tan, who represents KKM, and I was, excuse me with my terrible Malaysian, but it says Pejabat Kesehatan Melembah Pantai. So he's from my local level clinic, and he's calling on behalf of KKM. He was actually extremely apologetic and said that he explained the reasons why I wasn't contacted, but also he admitted some fault. Basically, he said that you're living in KL, but you went to get your COVID test in a different state, Selangor, where BP Glen Marie Shah Alam was, because that was just the nearest one to me by BP Glen Marie. And said because of that, your BP Glen Marie, they raised it at a state level, but then therefore at Selangor state level, therefore it was never sent to KL. So therefore myself from KL, I was never received any notification to contact you. So in a sense, you were lost in the system. So I went to the Petaling District Health Office, which is in the email from KKM yesterday, to say, you must go there and they will do some checks on you. And if you have no further symptoms, then they will give you a release letter, which therefore confirms that you are no longer a risk to society. And then you're free to enter into public.
Rupert's story is not unique. Previously, we spoke to another person who tested positive, who never heard from the Ministry of Health, and even after recovering, had immense trouble getting his release form. Besides making the SOPs more clearly defined and making better use of the MySejahtera app, Rupert has one more thing that he hopes Malaysia can do to improve the response to the coronavirus.
I would also suggest that they make the COVID test cheaper for people, for the general rakyat, because a number of my friends did not take the test because they thought it was too expensive. It costs, even for a local person, it costs 150 ringgit. For me, it costs, I think 190, but I saw on the test today in the center where I went to that it was 290 ringgit. And I think, would you really, if you had a little bit of a cold, would you spend 290 ringgit or 150 ringgit? Probably not, right? So I think one of the reasons is like it's causing like maybe people who are carrying the virus, not to test and spreading. One reason for the spreading of the virus is because they're not making this test free or cheap. You know, I think for the average person, 150 ringgit is a lot of money. I think that's not the attitude that they should have. And I spoke to my brother in England, and they said it's free there. You know, and that will encourage people to go and get tested more, right? You know, and I think that's something that they should do more of, because it seems like there's a lot of cases, you know, as well, like the number of cases that they report is probably much less than it actually is, because people don't report it because they don't want to spend the money to get tested. So I don't know how true that is, but I'm sure that there's a number of people that don't get tested because of that reason, right? Yeah, or they just say, never mind, maybe I got it, I'll just self-isolate for a few days. Like some of my friends did that, you know, they just, even my foreign friends, they said, I'm just going to self-isolate, and they didn't do the test.